right now is about the physical impacts that come with the coronavirus. We're talking coughing, fever, shortness of breath, some of those other symptoms. But also overlooked here are the impacts the pandemic is having on our mental health. So joining me live via Zoom this morning is licensed psychologist Dr. Grant Ward. Doctor, thank you so much for joining us this morning. How are you doing?
I'm doing well, thank you.
Good to hear that. So let's get into this discussion. What are you hearing from patients and clients right now when it comes to their mental health?
Well, what I'm hearing now is how can they stay connected with services? So with the social distancing orders, it's thrown a wrinkle into the work we do, which is face-to-face psychotherapy and testing. And so we've had to become innovative and creative very quickly to allow our patients to maintain the services they need. And we've added teletherapy.
And teletherapy, how does that work?
Essentially, it's in many ways the same as face-to-face psychotherapy. And in fact, research has shown it's as effective. As the psychologist, I think we lose some of the nonverbal and verbal cues that are very important for us in establishing rapport with our patients. But in the sessions I've done, I'm new to it this week, in the sessions I've done so far, I'm still able to maintain that rapport. Some information is lost, but I think less than my experience, my adjustment, the patients, they seem to be very comfortable with making that transition.
Yeah, good to see that technology is able to help people during this tough time. What are some of your biggest concerns when it comes to our mental health right now as we deal with this pandemic?
Yeah, biggest concerns are possible loneliness resulting from isolation, grief as a result of loss that we're all experiencing. We're all experiencing some form of loss now, whether it's personal or collective. Anxiety in a period of uncertainty where there's really no good roadmap for what we're experiencing. Anxiety is going to be a common issue that most of us experience. And this will be a time when we're tested on our ability to manage that anxiety and relax. Many of us don't have those skills developed like they should be.
So you mentioned anxiety there and dealing with that. What are some ways to manage that anxiety and to unwind and to relax?
I'm so glad you asked that question because I see experts across the country talking about it, and they'll speak in kind of non-specific terms. So this morning I really wanted to give some practical advice for managing anxiety. Number one, you have to be able to identify what you're feeling. And we're not all so great at that. So putting a name to the emotion instead of existing in kind of a nameless or wordless suffering, just naming the emotion or the experiences you're having, it could be physiological or emotional, will provide some structure to what you're feeling. Structure in itself provides some certainty and can help us relax a little bit. But of course, there's relaxation management. And when I talk about that, usually I'll see experts stop right there, but there's actually training programs for how to develop the skills of relaxation. We're not all naturally equipped to relax. It's not a skill we're necessarily born with. I like to use a sports analogy of shooting free throws. Anybody can go throw up a basketball at the hoop, but if you learn the proper technique, you practice, over time, you'll greatly increase your chances of success. And I just wanted to mention a few apps. We were speaking of technology. The APA, American Psychological Association, has investigated 3 mental health apps. There's hundreds of apps, but to help people really parrot that down, Headspace is one. Stop, Breathe, and Think, and Calm. So these are apps that can actually train you on how to develop your skill of relaxation.
Yeah, I've heard a lot about that Calm app. And one thing, Jonathan, I know he talks about it a lot here, meditation, just getting some of that meditation time to kind of relax your mind. Is that something you would suggest as well?
Absolutely. Meditation, mindfulness is another kind of buzzword in psychology right now. But again, just to tell somebody to, go meditate for a few minutes or be mindful, that's not all that helpful. You really need training in that. So that's where mental health professionals come in. That's where these apps that have been vetted by mental health professionals can be helpful. And once you do that, it might not be successful the first time. Like I mentioned, it's a skill, so it's practice and training. So eventually you'll be able to benefit from those exercises.
Okay, so what about parents? They're at home with their kids right now. A lot of their kids are missing prom, they're missing their graduation, their senior years, and that can be tough for kids. That can be tough for their children. What do parents do when it comes to their children's mental health?
Need to keep those lines of communication open as much as possible. So the children need to have a avenue to discuss how they're feeling, to talk about their disappointment and their loss. And parents, it's probably going to go over better with your teenagers if it's kind of in passing or not so formal. The little kids, the little tiny ones, all they really need to know right now is that they're safe. They have a strong base. They need your attention. So we actually have a treatment called PCIT where the effective mechanism is the parent's attention. So with the little ones, you want to give them your undivided attention for even a brief period of time, 5 minutes a day. That'll go a long ways. For your older kids, your adolescents, very difficult right now to be restricted at a time when they're supposed to be developing autonomy. And social relationships are so important for them right now. And so that term social distancing is really falling out of favor with professionals and being replaced with physical distancing because we need that social connectedness and social closening right now. And that'll be through apps and technology. But essentially, parents need to provide an avenue for their children to discuss how they're feeling. And possibly, I've seen a lot of YouTube videos of people recreating those important ceremonies and having Zoom meetings where people can still share in them. It's not the same, but you still get to mark the occasion.
Yeah, that keeping connected socially, very important. As you mentioned, not necessarily social distancing, but physical distancing is a more appropriate term there. I got to ask you, for people that are kind of cooped up in their homes with their families, some stress can build up, some tension can build up. I mean, you're with them most of the time there. How do you deal with that in terms of being just inside the home with your family? How do you unwind and kind of de-stress from a situation like that?
That's a great question. There's going to be a lot of adjustment during this period. We're out of our normal routines. So being cooped up in the home with your family, there's going to be a honeymoon period where people are adjusting to the new norm. And then there's going to be what's called a storming period where people kind of butt heads. And then you hope you can get past that to what's called a norming period where people understand the space they're living in, how to respect one another. So during this time, everybody is best to practice patience with one another. It's difficult, but patience, grace, while you're establishing those new norms in the household. Plus, there may be a competition or a strain on resources as far as internet. You may have one computer or not enough devices, and children may argue over who gets to use what when. And so having a schedule, kind of talking through how you're all going to exist in this space and respect one another, but also meet your needs of social connectedness and ability to do work from home. If you're working from home, you might have to establish a space that when mommy's in this space during this time, that means she's working, can't be disturbed. So it's really just communication and setting up those new routines.
Dr. Grant Ward, thank you so much for joining us this morning. Very, very good advice, and people cannot neglect their mental health in the middle of this. Thank you so much, sir.
You're welcome. Thank you.
Jonathan, let's get over to you.
All right, yeah, try to get outside today and see